menopause, a condition that has and will affect every woman on earth. Welcome to Focus on Health, a show on all matters health, wellness, and lifestyle. I am your host, Joy Bofenda, and joining us today is Dr. Amanda Kenya, an obstetrician and gynecologist who will be taking us through menopause. But before then, take a look at the health updates. Very informative health updates right there. And like we said, we have Dr. Amanda Kenya with us today, taking us on menopause. So maybe, Dr. Who is Dr. Amanda?
Yeah, so Dr. Amanda Kenya is an obstetrician and gynecologist who is really passionate about sharing information about women's health, because I believe that when women are empowered with up-to-date information about their health, then they're able to make better decisions for themselves and their families.
Okay. Yeah. So since the topic of the day is menopause, could you just give us an overview? What is menopause?
Right. So menopause is basically when our ovaries are done with their jobs. Okay. So these days women are living longer and longer, and so we are actually outgrowing and outliving our ovaries. So when our ovaries are done, they're no longer able to produce estrogen, progesterone, testosterone, and other hormones. Then we start suffering some side effects. So basically, menopause is when a lady has gone at least 12 months without a period. That's when we say she's menopausal. And a few years before that, most of the time, she's going to have some misbehavior of her periods here and there, as well as other symptoms. And that's the perimenopausal period.
Okay, yeah. So is there a particular age range for menopause?
Yes, there is. So the normal age range for menopause is 45 to 55. So anywhere in between that range, if you go into menopause, it's considered normal. And the normal age for perimenopause is 40 years to 44 years. So that means that if you go into menopause, that means you've gone a whole year without your period before the age of 45. We call that early menopause, right? Mm-hmm. And if you go into menopause before the age of 40 years old, then we call that premature menopause or premature ovarian insufficiency. And these conditions definitely require you to be treated with hormones if you're eligible. Yeah.
Okay, so what are the risk factors for early menopause and premature ovarian insufficiency?
Right, that's such a good question. So some of the risk factors include an increased risk of cardiovascular diseases. So that means heart attack, that means stroke, increased risk of developing dementia and Alzheimer's at a younger age, increased risk of developing diabetes and obesity, increased risk of developing weak bones, because estrogen really helps to keep our bones strong, and when you have weak bones, then they can break easily. So when you have when you go into menopause earlier than you should, that means your risk is even higher than someone who goes into menopause at a normal age.
Okay. Yeah. So in terms of perimenopause, could you give us the symptoms that someone should look out for?
Right. So the first thing most likely that you're going to experience in perimenopause is, first of all, there's two stages of perimenopause. There's early perimenopause and there's late perimenopause. So during early perimenopause, usually your period becomes irregular. So most of the time in the early perimenopause, your periods are going to come closer and closer together. So say, for example, if you used to have a 28-day cycle, your periods are going to become shorter by like 6 to 7 days. So maybe now your cycle is going to become 21 days. That means you're getting your period more frequently. And most of the time during early perimenopause as well, your period is going to be heavier. So women say, oh, I'm getting older. I thought my period should be less heavy and should be more far apart. Why is it coming closer? Why is it so heavy like a teenager? So that's what happens, and it can happen for quite some time, and the bleeding can be quite heavy to a point where you come to hospital needing a blood transfusion. So that definitely needs to be taken care of. And then during the late perimenopause phase, is where we see the period becoming further and further apart and also becoming lighter before eventually it disappears and you're menopausal.
Okay, so when someone establish the stage of menopausal, now what are the symptoms for menopause?
So the symptoms of menopause, apart from not having a period for 12 months, there are so many symptoms. That's the thing. And so many women are having symptoms of menopause without knowing. And they're busy going around getting tested for all sorts of things. And yet it's just menopause. So I think one of the symptoms that we all know about is hot flashes, right? I'm sure you've had someone talking about the hot flashes. It's different depending on the person, but many women describe feeling a feeling of heat coming from their core and spreading to the rest of their body, usually accompanied by palpitations, feeling like your heart is beating very fast, and accompanied by a feeling of anxiety. Some women just report feeling generally hotter than usual and sweating excessively. So that's hot flashes. You can also have cold flashes, okay, like a feeling of sudden freezing cold. Other symptoms include irritability and mood swings, which can become depression, can become anxiety. Women also report brain fog and feeling like they keep forgetting things. Mid conversation, they forget the word they're looking for. It happens quite often. Can be very debilitating for women who are working, because now imagine you're trying to make a presentation and this is happening. You literally forget even where you are. Some other symptoms include increased weight, especially around the midsection, muscle aches, joint aches, dry skin, thinning of the hair and falling off of the hair. You can even experience changes in your vision. You can experience changes with your taste and your smell. Suddenly, normal things that you used to smell now are really irritating you. Your favorite perfume, you can't stand it anymore. Sensitivity to certain noises, like suddenly people are breathing and you can hear everyone breathing and it's really annoying you. You can also experience something called the menopause rage. It's a feeling of extreme anger and irritation at everyone and everything, and it can't be explained. It's just what happens to some of us in the menopausal period. And then one of the big ones is having a reduction in your sex drive. So you have low libido, you're not receptive to your partner anymore, you're not desiring sex anymore. And then another major one is dryness of the vagina. So this is not only important for women who are sexually active, but even women who are not sexually active report that when they're sitting or they're walking or they're running or whatever they do, they can just feel that their vagina is so dry and tight and it's itchy and burning. So you can imagine that sex would be extremely uncomfortable even when you use the normal lubrications that we use. And then together with that, you have recurrent vaginal infections and recurrent UTIs, because the area down there, once it has been starved of estrogen, becomes really dry and tight and uncomfortable. So those are just a few of the symptoms that we can have during menopause and perimenopause.
Okay, so also many women complain about feelings of having arthritis when
Right.
So could you comment on that?
Yeah, so I had mentioned the joint pains. So basically, as we age, yes, our joints age with us and we expect some form of arthritis, but with menopause, it accelerates, right? Because our joints need estrogen, our bones need estrogen. So you can find different joints, especially the shoulder and the knees and the elbows, can become frozen and stiff and even swollen and inflamed.
Okay.
Yeah.
And so how long does menopause last?
Menopause, so once you've not had your period for a year, we say you're postmenopausal, right? And so from then on, you're postmenopausal. So menopause, you don't come back from menopause. You continue to, your ovaries will never wake up, basically. So I think what you're asking is, how long will you have these symptoms for? And it's so different for everyone. It can be 1 year to 15 years. There's no way of knowing. So you find a woman saying, oh, I haven't got my period in 2 years, so that means I'm in menopause and I can't wait for 1 more year for my symptoms to go away. But the thing is, we don't know when your symptoms will go away. They can last for the next 10 years or they can go away next week. There's literally no way of knowing.
Okay,
Yeah.
so do genetics play a factor in terms of the start of menopause?
They do play a huge factor. So generally speaking, if you know when your mom or your elder sister or elder aunties went into menopause, that's generally going to be the same age at which you go into menopause, unless you have any extenuating circumstances, like maybe you had surgery to remove your ovaries, because then you will go into what we call surgical menopause, or if you have chemotherapy or radiotherapy which destroy your ovaries, you go into menopause earlier, or if you're a smoker or a heavy drinker, or you take certain medications, you will go into menopause sooner.
Okay,
Yeah.
so in terms of now managing the symptoms of menopause, how best can they do it? Or do they actually need hormonal replacement therapy?
That's a good question. So, not everyone needs hormones, but most people will benefit from hormones. Hormone replacement therapy, which let's actually not call it hormone replacement therapy, let's call it menopausal hormone therapy, because we're not really replacing the hormones to a level like someone who is much younger than you. We're just giving you a little bit of the hormones you're lacking to reduce your symptoms and to make them go away. So we're not replacing, we're just giving you a little bit. It's a very low dose. Most people will benefit from hormones because hormones are the most effective way of treating menopause symptoms. And so that's always where we start in terms of whether you're eligible or not, right? Of course, if for whatever reason you don't want hormone therapy, there are other things that we do to help you with your symptoms. There's some natural supplements which we can try, and more than all this is lifestyle changes which we have to make, some lifestyle modifications that we have to make during the menopausal period to help you to battle your symptoms better. These include eating better, eating cleaner, a plant-based diet with lots of healthy fats and lots of protein and lots of fiber. And then also we need to exercise, especially resistance training and lifting weights. We're not doing the long marathons anymore. In the menopause period, we need to build muscle because that's really what's going to help us. And managing stress and reducing stress is also very important. Getting enough sleep as well.
Okay.
Yeah.
Such an informative session right there. And before we dive deeper, we'll be taking a short commercial break. But before then, take a look at the Did You Know segment. Welcome back to Focus on Health, and like we said, we have Dr. Amanda who's taking us further into menopause. Take a look. In terms of surgical menopause, let's say a 34 years old lady undergoes surgical menopause.
Yeah.
Do you have to now give them hormonal menopausal replacement therapy?
So for that girl, that's going to be hormone replacement therapy.
Okay.
Because she's gone into menopause at an age which is not appropriate for her. We need to give her hormones to make her hormone levels equivalent to someone her age. You see, that's different from making a 50-year-old equivalent to a 30-year-old. So she's going to need hormones if she's eligible, of course, if there are no contraindications and if it's safe for her. She would greatly benefit from hormones in order to make her not only live longer, but to just have a better quality of life.
Okay.
Yeah.
So you've also given us a range. Does it mean that individuals who are at that age range cannot get pregnant?
The ones who go into menopause,
Yes.
It's not that they can't get pregnant at all. If you still have your ovaries, once in a while you might sporadically ovulate and you can find you get pregnant, but it's definitely more difficult. So if you go into menopause at a young age, it's important for you to see a fertility specialist just to speed things up and help you get pregnant if you still desire that.
So they should also undergo hormonal replacement therapy?
Yes, they do go undergo hormonal replacement therapy, and then also they see a fertility specialist.
Okay, so in terms of fertility during perimenopause, is it decreasing or also increasing? 'Cause you also said that the menses is much heavier.
Yeah.
Does it increase the chances?
Yeah, so generally from the age of 35 onwards, as women, our fertility is going downhill, right? And it gets faster once you hit your 40s. So for everyone, whether or not you're in your perimenopausal period. So definitely once you start having perimenopause symptoms, it's going to be difficult to get pregnant. And also once you get pregnant, the risks of that pregnancy are going to be more than someone who's younger. But that doesn't mean that you can't get pregnant. So we often find women who are in the perimenopausal period, they're done having their babies, but they think because of the age they are, they can't get pregnant. So they're not using contraception, and then they do fall pregnant, and they're disappointed because that was not in their plans. So it's important to know that you can get pregnant, and if you don't desire pregnancy, then you should be using a family planning.
Okay, so what are some of the implications of menopause on our mental health?
Right, so remember I mentioned the irritability, the mood swings, anxiety and depression. It can be a really tough time to navigate for a woman, especially when she's surrounded by people who have no idea what's going on. They don't know how to support her. They just don't have the tools or the education. So it's really important for us to bring on board a therapist, a counselor, a psychologist, someone who can support her and her loved ones as well, to educate them about what's going on and that there's a way forward.
Okay, so also there's a correlation between constipation during the period of menopause. Could you also comment on that?
Yeah, estrogen, which is the hormone we're lacking in menopause, it literally has a job to do in every single organ in our body, including our intestines. So you can find someone with perimenopause or menopause having diarrhea, constipation, problems with digesting food, so you get bloating and nausea. All these are possible in the perimenopause and menopause period. And so if you feel like you're in that age range and you've been tested for all sorts of things for your new gastrointestinal symptoms and it's not working, see a gyna and consider that may be due to menopause.
Okay, and also there is this narrative that estrogen tends to cause breast cancer. That's why most people don't go into treating menopause. Could you
Yeah.
also comment on that?
Good question. So that information came from a study which was done in 2002 that was testing hormones and women of the postmenopausal age range. But the study, although it was a good study and we got a lot of information from it, a lot of it was misinterpreted, and that misinterpretation has led to us not giving women the hormones that they need to make them feel better. So the one about estrogen, for example, the one that we commonly use for women who have reached menopause, estrogen actually prevents, it actually leads to a reduction in the risk of breast cancer, not the other way around.
Okay,
Yeah.
and what about ovarian cancer?
For ovarian cancer, no, estrogen has no part to play.
Okay.
Yeah.
So when an individual now starts seeking hormonal replacement therapy or menopausal therapy, how long should they be under the medication?
So first of all, it doesn't matter how long ago your last period was. If you still have symptoms that are significantly bothering you, you can start the hormone treatment. And also you can be on hormone treatment for the rest of your life if you need them. We stop them when you're no longer benefiting from them or when the risks outweigh the benefits.
Doctor, you've also said that it affects vaginal health. Could you
Yeah.
also comment on how to manage it?
Right, so that's a huge one that so many women are dealing with, but they're suffering in silence because they think this is just what happens when I get to this age, so there's nothing I can do about it. So they're suffering in their relationships, in their marriages, and they feel like there's no way out. So here's the thing about vaginal dryness in perimenopause and menopause. This one, we deal with it with estrogen gel. Okay, so it's a gel which is inserted into the vagina, and very, very, very little of it gets into your bloodstream. So maybe you have reservations about using the pills or the patches that we give for the other menopause symptoms. But for vaginal estrogen, you really should have no reservations because it only works locally at the vagina, and does its job there without getting into the blood. So your risks of all those other things that you're afraid of are almost zero. So it's a gel that is inserted into the vagina one night every couple of days or every 3 days. It really helps to bring your vagina and your vulva back to life. You know, even the clitoris and the labia, they all shrink up during the menopause period and become dry and itchy and irritated. So this gel is going to really plump things up, reduce the itchiness and the pain, the dryness, the burning, and make it so much easier to have intercourse and to enjoy your sex life with your partner. And it's something that I think most women from the age of 40 onwards should start using prophylactically, which is to mean preventatively, not waiting for things to go downhill before you start working on it. But I think every lady who is 40 years and older should be using vaginal estrogen cream in advance to prevent these negative effects of menopause on the vagina and the vulva.
Okay, so also in terms of sex during menopause, what type of lubricants should they use?
Yeah, so there's so many kinds of lubricants that we like. The silicone-based ones, they're really good. So maybe it's not so much the which brands do I know? Let me not mention any brands since we're not being endorsed. But you find even many of the lubricants that are in the market might not even, be good enough for you. So you might need some that are specialized for postmenopausal women, that maybe are water-based and have more slip to them because of the water and the silicone, that might work better for you. So I would talk to your gynae about it.
Okay.
Yeah.
So also during when a woman has fibroids, does it tend to decrease during menopause?
Yeah. So fibroids actually respond to our hormones. So they respond to estrogen and progesterone, which is why fibroids grow during pregnancy, because now we have more hormones and so they're getting bigger and bigger. So definitely once you have less hormones in your system, fibroids are shrinking. So we find, say for example, if you're very close to menopause and you have fibroids that are bothering you, most of the time, if we just give it some time, they will shrink, because during menopause, that's what happens.
Okay, so also could you just give us a run through the management of menopausal symptoms, especially the arthritis? Is it arthritis? The constipation and all that other stuff.
So we have already discussed the management. So number one, which is the most effective, is the hormone treatment. And all of these can be done at the same time, by the way. It's not one or the other. So there's the hormone treatment. There's some supplements we can give you depending on your specific issues, if it's sleep, if it's digestive symptoms. And then the lifestyle modifications. We are going to work on your diet. We're going to work on your physical activity and start you on a program to train you to do resistance training and weightlifting. We're going to manage your stress a little bit better. If we need to involve a therapist, we do so. If you need something to help your mood, like an antidepressant or an anti-anxiety medication, we can give you that. And then also education. Sometimes just being educated on what's going on with the body is treatment, rather than staying in ignorance and just not knowing what's going on, and yet you have such terrible symptoms. Education is a treatment. And then after that, also just educating the rest of the community is part of treating you, because now we're working with the stigma. There's a lot of stigma about menopause. But I'm sure you've heard as a joke when you're sweating a lot, where you're like, it's so hot in here, and someone says, oh, are you in menopause? It's not something to be embarrassed about. So I think it's something we can work on at a community level as well. Yeah.
Okay, so also women tend to now look at using herbs. Is that really convenient?
I would say I have nothing against herbs, but we need to know whatever you're putting in your body, what exactly is it, and how much of it are you taking? Do you know the side effects? So if it's not something that has been studied rigorously, I would have reservations, because some of the drugs we give are herbal medications, but they're just in a form that has been prepared and formulated well in a lab that has been studied. Like, we know exactly what you're giving you and we know what to expect. So rather than going to these herbs which we're not so sure about, we can still give you herbs, but let us give you the ones that we know actually work and that are not harmful and that are prepared in a safe way. Yeah.
Okay. What are the contraindications for giving hormonal replacement therapy or menopausal therapy?
It's at a very individual level. So what you're going to do when you go and see your doctor and ask about hormones is they're going to take you through what we call history taking, which means they're going to ask you so many questions, not only about your own personal medical history, but your family history as well, any diseases you've had in the past or conditions. Have you ever had a clot in your lungs or in your legs? Do you have migraines? Some questions will be asked specifically to see if you're eligible or not.
Okay.
Yeah.
And what if you're not eligible? What happens?
If you're not eligible for hormone therapy, then like I said, there's a list of treatments that we can give. So most likely then we'll move on to the supplement part and just focus on that with the lifestyle changes.
Okay.
Yeah.
Maybe, Doc, you can give us your parting shots in relation to menopause.
My parting shot is, as a woman, you deserve to have a full, happy life throughout all your ages, right? We often see women from the age of 50 and above being neglected. You don't think that you deserve to have a happy and well sexual life anymore. Insurance doesn't even cover, most insurances don't cover anything to do with hormones or menopause. People think you're just there now to take care of the younger people, and you don't deserve to have a good life from now on. Most women live more than a third of their lives post-menopause, right? So you deserve to be happy, you deserve to be well. You don't deserve to be having these symptoms and keeping them to yourself and not having anyone to talk to or any recourse. You deserve the education, you deserve to know what's going on. So I'm here to let you know, please reach out to a gynae, someone who is experienced and comfortable dealing with menopause, and please get help for your symptoms because it doesn't have to be like that.
Okay, so Doc, maybe tell us, where can we find you?
Yeah, so my number is going to be on the screen or in the caption, 0769 160 You can send me a WhatsApp or call me if you have a question, and then also feel free to reach out to me on Instagram. That's Dr. Kenya at drkenyaobgyn.com, and that's also my TikTok.
Okay, so
Yeah.
as we finish, have you ever had any myths and misconceptions concerning menopause?
Myths and misconceptions. I think the most common one is that hormones are very dangerous and you should not go anywhere near hormones when you're postmenopausal or perimenopausal because they are going to cause breast cancer and blood clots and all sorts of things. It's not like that, at least not anymore. So come, let's have a longer conversation about it and get you on some treatments to make you feel better.
Every woman deserves a fulfilling life, even in menopause. That's from Dr. Amanda. I have been your host, Joy Bofenda, and until next time, stay safe, stay healthy, and live with the Healthy You segment.